Hi, everybody. I am so excited to see you here on my YouTube channel, The Fibroid Doc. This August, I am launching a series called Fibroids and Fertility. This is a topic that I deal with very commonly in my practice. I see many patients who are struggling with getting pregnant. They have fibroids. They are trying to figure out what to do. Should I take out my fibroids? How should I take out my fibroids? Am I going to be able to get pregnant? Will I ever realize the dream of having my family? So many emotions, questions, decisions that go into this if you have fibroids and you are trying to get pregnant. So I'm going to break this down into many topics this August. We will be releasing a new video every Monday, so watch out for that. And I would love to answer your questions as well. So please send questions, comment, and I will make more content for you guys. So today we're going to start with the question, will my fibroids stop me from getting pregnant? I've got all my notes and I'm excited to dive into this topic with you guys and, for the rest of August as well. So before I start, I'm Dr. Prabakar. I'm a board certified OB-GYN, minimally invasive surgeon. I practice in Northern California, and about 40 to 50% of my practice is fibroids and endometriosis and pelvic pain. So really surgical gynecology. And another 40% is menopause and sexual health. And actually, these topics tie in a lot together because many patients who are undergoing fibroid surgery then also end up having, undergoing menopause. And I have a whole new video on that. So check that out on my YouTube channel. But for today, I digress. Let's come back to our topic for today, which is, will my fibroids stop me from getting pregnant? So I'm going to give you 5 things to consider as we discuss this. So as I started this video, I was talking about all the fears that people have when they know they have fibroids. First of all, my goodness, is this going to become cancerous? Is this going to grow? Is this going to prevent me from getting pregnant? Do I need surgery? All these thoughts are ruminating in your mind. You're Googling for answers. You're trying to figure out what it is, you need to do now that you know you have fibroids. Maybe this was kind of an incidental finding. So you were getting a scan for something else and they said, hey, you have a fibroid. Or maybe you're in the process of IVF and they were like, oh, you've got a fibroid, we need to have it removed. And immediately you're thinking, is this what's preventing me from getting pregnant? So let's talk about this topic. And by the end, you'll have kind of a better idea of what types of fibroids impact fertility, should you consider surgery, and just a clearer roadmap into determining what you need to do, if anything, before you get pregnant and in order to have a successful pregnancy. So, number one, the first point that I want to say, there are 3 different types of fibroids, and what type of fibroid you have will actually determine whether this is going to be a problem. So when we think about the uterus, we've got a cavity right in the middle. This is where a baby forms. This is the lining that sheds every month, that gives you your period. So it's the middle, and that's your endometrial cavity. And fibroids that grow in there are called submucosal fibroids. So you may have seen that term. You may have read it in your ultrasound or MRI report. So submucosal fibroids are right in the cavity, and these are going to be a problem, right? And it because this is where the baby forms. If you're doing IVF, this is where they put in the embryo. So we want this to be nice and clear. The second is intramural. Intramural means these are in the wall. This is in the wall of the uterine cavity. I'm sorry, not the uterine cavity. This is in the wall of the uterus. And so these fibroids, it can be a little tricky as to whether these are going to be a problem or not, because they're not in the cavity, but they're in the wall. So if you've got a really big fibroid in the wall, like 5, 6, 7, 8 centimeters, this can slowly start to push into the cavity. And so it can become a problem. Maybe not a problem right now, but it could become a problem. And then you've got the third one is a subserosal, which means it's sort of on the outside of the uterus. It's hanging onto the uterus. It's growing from the outside. So these are less problematic when it comes to fertility because again, we're really worried about the cavity. We're worried about anything that's inside the cavity. We're worried about anything that's pushing on the cavity. So subserous fibroids are more or less on the outside, and these can grow and they can cause things like pain and pressure, but these are less likely to actually be a problem. So, first, I want you to know that there are three types of fibroids, and where they are can determine and impact your fertility. Not all fibroids are the same. Okay, number two, it's not all about size. Okay, so the first point is we learned the three different types of fibroids. And the second point is it's not all about size. Because you could have a 1 centimeter, tiny, tiny submucosal fibroid, which is going to cause more issues than a 7 centimeter subserosal fibroid. Okay, so the subserosal is on the outside, it can be 7, 8 centimeters. That's going to cause less of an issue than this 1 centimeter one that's right in the cavity. Because again, this is where the baby forms. So you don't want an embryo to be traveling up and then hitting that fibroid and bouncing off. Same thing with IVF. You don't want to transfer an embryo that's going to go right, and implant on that fibroid or bounce off and just not implant. These can cause miscarriages, just failed embryo transfers, or just failed pregnancy, even if you're not going through IVF. So it's not all about size. It's really about location, as we saw in point number one. Um, and then number three, the third factor that I want you to think about when you think about fibroids and fertility are kind of the other factors that are going on in your life and in your health at that moment, right? So fibroids, when you're 20 are very different from fibroids when you're 40 or 45, because now we're also thinking about quality of eggs, quality, just the readiness of your uterus, maybe other health factors that are also going on. Maybe you have high blood pressure now. Maybe you're starting to have pre-diabetes. Maybe you're, starting to go through perimenopause, right? So we have to look at the whole picture as well and not think, oh, well, I'm not getting pregnant because of my fibroids, right? We have to kind of take a step back and look and see what else is going on. And there are many tests for this: ultrasounds, blood work, make sure your tubes are open. There are several tests that specifically look at, GYN wise, is everything good? And then your partner, is the sperm okay, the quality, the motility. So I urge everyone to take a step back, and kind of take a global view of what's going on with your health. Because when you have fibroids, it's easy just to kind of bury your head and say, oh my gosh, it's the fibroids. This is what's, preventing me from getting pregnant. What do I need to do? And just kind of go down this rabbit hole. And you may have to go down that path, but you may also have to be taking care of some other things. Is your diet good? Are you using the least amount of plastics that you can? Because that also is a reproductive toxin. So are you working out? Are you getting good sleep? Is your immune system good? So there's a lot of other factors that I really want you to take stock of, and look, a little more globally and see if there's anything else you can tweak other than just, the fact that you have fibroids. Okay. Number four, you also want to see how else fibroids are affecting you. Okay. So is it just the fact that you're nervous you're not going to be able to get pregnant? Or are you also having heavy bleeding? Are you having pain and pressure? Is it pressing on your bladder and you're not able to, you're peeing often like you're pregnant? So there are many other ways in which fibroids affect women. And in the path to pregnancy, we're asking the question, like, are fibroids going to prevent me from getting pregnant? But you also, again, want to take a step back and see how else is it affecting me, because that's going to really determine, what you want to do about it, going down the line. If it's just a fertility thing versus, whether I get pregnant or not, I need to live a good quality life. And these fibroids are preventing me from doing that. I've had a lot of patients say that to me, where they're like, it's great if I get pregnant, but I don't really want to be bleeding like this. I don't want to be getting blood transfusions and iron transfusions. And they really just don't want to deal with that. So as you're going through the fertility process, also be documenting and taking stock of how else, fibroids are affecting you. So, will fibroids prevent me from getting pregnant? The answers really depend on, where the fibroid is. And we talked about the three different locations. Size doesn't always matter. So if you've got a small one, in the cavity, that's going to be an issue and something that you definitely want to remove. What else? We talked about other factors that influence conception. So not just the fact that you have fibroids, but what else is going on in your health. And number four, how else are fibroids affecting you? What kinds of symptoms are they causing? And this will sort of determine, whether you actually want to do something about it. And number five, having a mindset of being open to intervention. A lot of times I see patients in the office who are like, I've got fibroids. I want to do all the natural things, but I'm also trying to get pregnant and I really don't want surgery, right? Which I understand. Nobody really wants to go under anesthesia and have surgery if you don't absolutely need to. But many times, given the location, the particular size, the effect of the fibroid on your cavity, this may be the magic answer to you getting pregnant. So yes, you can do natural things, all the things that I talked about, anti-inflammatory, reduce plastic toxins, take your vitamin D, do green tea extract. You can do all of these things, which are all helpful for good quality of life and definitely for fertility as well. But, have an open mind to surgical intervention because this 30-minute procedure may literally be the magic thing that, gets you pregnant. So those are my five points that I wanted to cover for you guys with this topic of, will my fibroids stop me from getting pregnant? And I hope these have been helpful things for you to think about. Take some of these points with you to your gynecologist for your next consult. If you are somebody who has fibroids and you're thinking, oh, like, is this going to prevent me from getting pregnant? Do I need to start now? What else do I need to do to get prepared? These are the conversations that you want to start having now. And if you're in the Bay Area and you've got fibroids, and you're thinking all of these things that I just talked about, come and see us. We're at La Miranda Gynecology and Surgery. Dr. Christensen and I are both minimally invasive surgeons. We do a lot of fertility work with fibroids. And so we're happy to see you for a consult and guide you through this process. So, call us for a consult. And don't forget to watch my next video, which is going to be, should I remove my fibroids prior to trying to conceive? Okay, so we touched on that topic a little bit, but I'm going to dive deep into, that whole decision algorithm of whether you should remove your fibroids prior to trying to get pregnant. Okay, so I will see you in my next video. Please share this episode with somebody who is a friend, colleague, somebody who has fibroids and is struggling with this decision. I'm sure that they will thank you very much. All right, guys, I'll see you in the next one. Bye.